Your kidneys are working right now, both of them, quietly filtering waste from your blood, the kind of work that happens 24 hours a day without you thinking about it once. But here's what most people don't realize. By the time a doctor officially tells you that your kidneys are failing, your body may have been sending signals for months. Not dramatic signals, not the kind that land you in an emergency room, but signals, small, easy-to-miss changes that happen so gradually, you might chalk them up to getting older or being tired. The problem is, missing those early signs could cost you years of kidney function you can never get back. Today, I'm going to walk you through 5 changes your body may make long before any lab test confirms kidney disease, and exactly when you should call your doctor about them. Welcome back to Health Insights. Today, we're focusing on the warning signs your body may send before kidney problems become more serious. Kidney disease is different from a heart attack or a stroke. It often doesn't announce itself with sudden, dramatic symptoms. It can develop quietly, which is exactly why early warning signs are so easy to overlook. According to the CDC, millions of Americans have chronic kidney disease, and many don't know they have it. One reason is simple. Early kidney problems may not feel like a disease at all. When feeling tired, getting older, sleeping poorly, going to the bathroom more often, and that's why knowing what to watch for and knowing when a symptom deserves medical attention can make such a difference. The information I'm sharing today comes from established medical research, nephrology guidelines, and what we know about how kidneys actually fail in the real world. This is not medical advice, and if you're watching because you've noticed changes in your own health, you should talk to your doctor. But if you've ever wondered why kidney disease is called the silent killer, or if you're worried you might be missing something important, this video is for you. The invisible crisis. Let me ask you something. When was the last time you thought about your kidneys? Unless you've had a health scare or someone you love has been diagnosed, most people don't think about them at all. They think about their heart. They think about their lungs. They think about cancer. But kidneys? Kidneys are the afterthought. And that's the first problem. Your kidneys are about the size of your fist. You have 2 of them, one on each side of your lower back. Their job is straightforward but enormous. Filter your blood. Every single day, your kidneys process about 120 to 150 quarts of blood to produce roughly 1 to 2 quarts of urine. That urine carries away waste and extra fluid. Fluid builds up. Your body becomes toxic. This is not a metaphor. This is what happens. For decades, your kidneys can work even when they're damaged. A healthy kidney operates at about 100% function. If you lose half your kidney function, if you're down to 50%, you might feel completely fine. You might have no symptoms whatsoever. This is the trap. Your body doesn't alert you to gradual damage the way it alerts you to a broken leg or food poisoning, and that's why early detection matters so much. If a doctor catches kidney disease when you still have 30 or 40% function left, there are real things you can do to slow it down, to preserve what you have tames, to avoid dialysis or transplant. But if you don't catch it until you're down to 10 or 15%, your options shrink dramatically. The warning signs I'm going to describe today are not symptoms of kidney failure. They're the body's way of responding to kidney damage that's already happening. They're the whispers before the crisis. Why these changes develop slowly? Before we talk about the 5 warning signs, you need to understand the basic pattern of how kidney disease progresses, because that pattern is the reason these early signs are so easy to miss. Kidney disease usually develops in stages, and this is called hyperfiltration. Your remaining good kidney cells are filtering more blood, working overtime, trying to keep up. And at this stage, you might not feel anything. Your blood pressure might be stable, your energy might be fine, but your kidneys are under stress. As kidney disease progresses into stage 3, the damage becomes more noticeable, but not in the obvious way. Your kidneys still seem to be working. Your basic blood tests might not even show a problem yet, but your body starts to notice things are off. Waste is building, and here's the crucial part. These changes are gradual. They don't happen overnight. A person can develop high blood pressure over months and not realize it's connected to their kidneys. They can feel more tired and assume it's work stress or aging. They can notice their ankles are a bit puffy and think it's the heat or sitting too long. None of these things in isolation screams kidney disease, but together, in the right pattern, they tell a story. This is also why so many people miss these signs. Our bodies are constantly changing. We're always experiencing small aches, shifts in energy, minor swelling. The challenge is learning which changes matter, when they matter, and what combination of changes is worth a phone call to your doctor. Here's where the story changes for most people. The first warning sign is fatigue. But not just any tiredness. I'm talking about a specific kind, the kind that lingers, that doesn't improve when you sleep, and that seems to creep in over weeks or months. Why this happens when your kidneys are damaged. They stop producing enough erythropoietin. We call it EPO. This is a hormone that tells your bone marrow to make red blood cells. Red blood cells carry oxygen throughout your body. Fewer red blood cells means less oxygen delivery to your muscles and your brain. Here's where the story changes for most people. This condition is called anemia, and it's incredibly common in early kidney disease. You can't think as clearly. Your muscles feel heavy. A flight of stairs feels steeper than it used to. You might find yourself needing a nap at 2 in the afternoon, even though you slept fine the night before. What makes this easy to miss? People usually blame fatigue on something else. They blame it on getting older. And, sure, aging does affect energy, but kidney-related fatigue has a particular quality. It's persistent. It's disproportionate. You might be doing less than you used to, but you're feeling more tired. The problem is, none of those things fix it. More sleep doesn't help. More caffeine doesn't help. Because the real problem is happening silently in your kidneys and bone marrow. The important nuance. Not all fatigue is kidney-related, of course. Many things cause tiredness. Depression, sleep apnea, thyroid problems, heart disease. But here's the important distinction. If your fatigue is developing alongside other changes on this list, and it's not improving with normal sleep and rest, it's worth mentioning to your doctor, especially if you have risk factors for kidney disease, diabetes, high blood pressure, or a family history. The practical question. Have you noticed that you're more tired than you used to be, even though your sleep hasn't really changed? That's a question worth sitting with, and the next point may explain why this is so often overlooked. Swelling, we call it edema in medical terms, is one of the most visible early signs of kidney disease, but it's also one of the easiest to rationalize. You might think it's because you've been standing too long. You might blame it on the weather or the salt in yesterday's dinner. You might think your shoes are just tight, but edema from kidney disease has specific characteristics. They're supposed to keep the right amount of water in your bloodstream and the right amount in the spaces between your cells. When kidneys are damaged, they start leaking protein into your urine, a condition called proteinuria, and they're unable to regulate sodium properly. When sodium stays in your body, water follows. Fluid accumulates, especially in areas where gravity pulls it downward. Your ankles, your feet, sometimes your lower legs. What makes this easy to miss? Not all swelling is kidney disease. Many things cause puffy ankles, standing all day sitting with your legs crossed. Pregnancy, heart problems, thyroid issues, even certain medications. But here's the distinction that matters. Kidney-related swelling typically affects both legs equally. It gets worse as the day goes on or after you've been sitting, and it doesn't improve much with elevation or a diuretic pill you might take for blood pressure. The important nuance: if swelling appears suddenly, or if it's only on one side, that's different. That could be a blood clot or a local infection, and you should get checked right away. But gradual swelling in both feet and ankles over weeks that worsens by evening, that's worth a conversation with your doctor, especially if you also have high blood pressure or diabetes. If the indent stays there for more than 2 seconds after you release it, that's called pitting edema, and it's significant. That's worth documenting and mentioning. Point 3. Changes in urination patterns, 1445 to 1800s. Before you assume that means something serious, consider this. One of the most direct warning signs is a change in how often you urinate, or what your urine looks like. But here's the thing. Urination changes all the time. You drink more water, you urinate more. You drink less, you urinate less. You have anxiety, you urinate more. You're aging, and your bladder capacity changes. For what you're urinating, this means they can't remove as much waste from a smaller volume of liquid, so your kidneys produce more urine to get the same amount of waste out. You might find yourself urinating more frequently, especially at night, a condition called nocturia. You might wake 3, 4, 5 times a night. Over time, this fragments your sleep and contributes to the fatigue we talked about earlier. Additionally, damaged kidneys can allow protein to leak into the urine. This makes your urine foam or bubble. It might look frothy like the head on a beer. Even if they notice a change, they might not think it's significant. Foamy urine can happen occasionally for lots of reasons. Nocturia is often blamed on age or just something that happens, but the key is pattern and consistency. If you're regularly seeing foam, or if you're waking multiple times a night to urinate when that's new for you, that's different. The important nuance changes in the color of urine, like darker urine or even blood in the urine, can indicate kidney disease, but they can also indicate urinary tract infections, kidney stones, or other problems. Any blood in the urine is worth getting checked, but foamy urine without blood, that's more specific to proteinuria and kidney disease. What to notice? Next time you use the bathroom, take a moment. Does your urine look different than it used to? Is it paler, darker, foamy? That observation, noted a few times, is useful information for your doctor. That sounds simple, but there is another piece. Blood pressure is the fourth warning sign I want to talk about. Now, high blood pressure itself can be a risk factor for kidney disease. They feed each other. If you have hypertension, it can damage your kidneys over time. But here's the twist. Kidney disease also causes high blood pressure. Why this happens when kidney function declines? Your body activates the renin-angiotensin system, a hormonal cascade that raises blood pressure. Your kidneys also produce less of a substance called prostaglandin, which normally helps regulate blood pressure. The result is that people with kidney disease often develop hypertension, or their existing hypertension becomes harder to control with the medications they've been taking for years. What makes this easy to miss? If you've already been diagnosed with high blood pressure, you might not realize that a change in your blood pressure pattern is significant. You might have been well controlled on the same medication for a decade, and suddenly you need a higher dose, or you need a second medication added. This shift could indicate that your kidneys are worsening. But many people assume it's just aging, or that their body has adapted to the old dose. They don't connect it to their kidneys. The important nuance: this is why it's crucial to monitor your blood pressure regularly. If you're on blood pressure medication and your readings are creeping up despite medication, that's worth discussing with your doctor. Practical action. If you know your usual blood pressure, get a home monitor and track it. A pattern of rising numbers is more telling than a single high reading. And the next point may explain why this is so often overlooked. The fifth warning sign is more subtle, and it's one that people often don't connect to their kidneys at all. It's a change in appetite, nausea, or a persistent metallic taste in the mouth. These are symptoms of uremia, a condition where waste products build up in the blood because the kidneys aren't filtering them out efficiently. Why this happens as kidney function declines. Waste products like creatinine and urea accumulate in your bloodstream. These substances are one of the first places you notice this toxicity is in your digestive system. Nausea is common. You might feel a slight queasiness, especially in the morning or after eating. You might lose interest in foods you normally enjoy. You might notice a metallic or bitter taste in your mouth. Sometimes people describe it as tasting like they have a penny on their tongue. This taste comes from the buildup of uremic compounds. What makes this easy to miss? Nausea and appetite changes have 1,000 causes. Stress, anxiety, medications, acid reflux, food sensitivities, infections. The list goes on. The problem is, these symptoms are vague enough that people don't usually rush to the doctor, especially if they're mild. The important nuance. If nausea or appetite changes appear alongside other signs on this list, like fatigue, swelling, or changes in urination, that combination becomes more significant. The metallic taste is particularly worth noting because it's less common from other causes and more specific to uremia. When to pay attention. If you notice a persistent metallic taste or if you've lost interest in eating normally, and this is new for you, especially if you're also experiencing some of the other warning signs, that's a reason to call your doctor. Practical next steps. So let's say you've recognized yourself in one or more of these warning signs. What should you actually do? First, don't panic. Having one of these symptoms doesn't mean you definitely have kidney disease. Fatigue, swelling, blood pressure changes, and nausea can come from many sources. But if you're experiencing one or more of these changes, especially if they're persistent or worsening, here's what I recommend. Schedule a doctor's appointment call, your primary care doctor or your nurse hotline. Describe specifically what you've noticed. Don't minimize it. If you're having new fatigue, mention it. If you've noticed swelling, say so. If your urine looks different or you're waking up multiple times a night, tell them. Give them the pattern, not just one instance. Bring information. If you have a blood pressure monitor, bring recent readings. If you know your weight, note whether it's changed recently. If you've been tracking your urination changes, describe the pattern. Concrete details help your doctor assess the situation. Get basic testing. Your doctor may order simple blood tests, a creatinine level, which measures how well your kidneys filter waste, and a glomerular filtration rate, or GFR, which estimates your actual kidney function as a percentage. They may also check your blood pressure and do a urinalysis to look for protein. These tests are straightforward, affordable, and incredibly valuable. Ask direct questions. If your doctor hasn't mentioned your kidneys, you can ask directly, "Should we check my kidney function? I've been noticing some changes." If you've had blood work done before, you can ask, "Has my creatinine level changed compared to last year?" Understand your risk factors. You're at higher risk for kidney disease if you have diabetes, high blood pressure, a family history of kidney disease, or if you're over 60. If any of these apply to you, kidney screening is even more important. When to seek urgent care if you experience sudden severe swelling, difficulty breathing, chest pain, or severe back pain. That's not something to wait on. Go to urgent care or an emergency room. These could indicate a more serious problem. Why early detection changes everything. Let me circle back to where we started. Your kidneys are working right now. If they're healthy, thank them silently. If they're not, the fact that you watch this video means you're ahead of the curve. You're thinking about it, you're paying attention. The 5 warning signs we discussed today, fatigue, swelling, urination changes, blood pressure shifts, and appetite or taste changes, are not proof of kidney disease, but they're signals worth taking seriously. They're the whispers before the crisis. Here's what research consistently shows. When kidney disease is caught in the early stages, when you still have 30 to 40% function, there are real interventions that slow progression. Better blood pressure control, dietary adjustments, medication management, lifestyle changes. These things matter enormously when you have time to implement them. But if you wait until you have end-stage renal disease, your options narrow to dialysis, transplant, or very limited management. The difference between those two scenarios is often just this: paying attention, noticing the whispers, calling your doctor instead of dismissing it, taking action when things are still subtle. I also want to say this clearly. I'm not a doctor, and nothing in this video replaces a conversation with your healthcare provider. If you recognize yourself in these warning signs, please reach out to your doctor. Not eventually, not when you remember, soon, because your kidneys are working hard right now to keep you alive, and they deserve your attention. If this information was useful to you, please subscribe to Health Insights. We cover the early warning signs of diseases people often miss, because catching things early is where your power really lies.